Economics, here today at the World Dental Forum in Macau, China, and I'm sitting with Dr. Kenneth Malament, and we're going to discuss a little bit about what Dr. Malament was just speaking about to wrap up day one of the World Dental Forum. And I know one of the things that you talked about today was the monolithic revolution. What is that, and why is it important to our viewers?
Well, I think there's 3 points that are important. First of all, the concept of material testing has changed very, very rapidly and very strongly. The team at NYU with Ben Thompson, Diane Macau, Nelson Silver, and Petra Goose really almost revolutionized the way we look at material testing and expectations of how these materials might do clinically. And one has to really understand that so many of the materials that we've tested or worked with clinically up to now, the dentists really were the guinea pigs as far as, is this material going to work or is it going to work? And we've had tremendous problems with a lot of materials that have not lived up to the expectations that the companies told us would work. So, you know, the monolithic revolution has started profoundly, particularly with the material, this lithium disilicate material described as EMAX,
Yes.
which is, it's the only one of its kind. One, it's a stiffer material than we've ever worked with before, and to a full contour. It's a material that, to date, I've done 500 units, essentially 492, and in 2 years, which is not a lot of time, but we have not seen a chip or a break or a crack or a fracture or a failure at all, which is really, really remarkable, because within my database and my research with Dr. Sokransky, every restoration, ulceratic restoration, does break within the first 2 years. Some more than others, and to see a material that has shown no failure whatsoever it really is unusual, and it's also a very beautiful material. But I think the question of why this material is so groundbreaking and where we are with the monolithic revolution is, if CAD/CAM dentistry is ever to really be successful, and it will be successful, it may not be perfect now, but in the next 10 to 15 years it will be, we have to create smart systems, and systems that can go to full contour, and so that the machines can go to full contour accurately with algorithms of fit that are very accurate, occlusal forms with smart articulators, and the spectrophotometric numbers. But now you're looking at the full contour. Once you go to full contour, industrial laboratory technology becomes real. So there are factories that are being built today, certainly Nobel, Straumann has this fantasy, and there's some big commercial laboratories as well, where their fantasy is to be able to put out 300 to 400 units a day in modern CAD/CAM technology, where the material's color will be excellent and the form will be excellent, allowing more patient communication with the dentist and the technician and technical staff. But it's a big difference going from a bilayer material where you have a core in something, and then you're going to put feldspathic on top of it. The artistry of using powder is far more demanding than smart system where you have some of the greatest technicians in the world that have waxed these forms up, and now everything becomes sort of just do it, put it into function. So we're going to see dramatic changes in the next 15 to 20 years. We may not be there yet, but it's definitely coming. And I think one should be conscious of it.
You know, what you listed in one of your slides, some things that CAD/CAM needed to get to, and do you think that there were like 5 or 6 of them? Do you think that they will get there in the next 15 to 20 years?
Yes, absolutely. I think even this year at Cologne, we're going to start seeing things, smart systems that really almost teach the dentist what has to be done. Still, you have to go to the treatment wax or some form where you could take the model that you want aesthetically, put it in the patient's mouth, and maybe take another scan to actually make it work. But digital impressions, digital articulation, fit will improve obviously. But I don't see any material even challenging lithium disilicate. I don't see any challenging. Even the concept of creating a one core of a material and then CAD-camming another material to press on top of it, that's interesting technology, but it's a lot more work for industry, and it doesn't allow the dentist, if they have to add a contact there or change the occlusion or just do something, it may present a challenge. And I think ultimately what we want is a full monolithic form. And zirconia is maybe challenged now with its feldspathic combination, but there's blended zirconias out there. Yu Zhang, who's a PhD in ceramic science and member of the NYU team, is working on one. There's a lot of interest out there, but again, to look at the art and the aesthetic dentistry, it's form, it's the depth, the stratification of the color, it's the occlusion that you create, it's the marginal form that the dentist has dictated. There's a lot of factors that go into creating that, quote, most aesthetic crown. And I think that the lithium disilicate today offers us the best opportunity to really create an aesthetic form. To say nothing about Daniel Edelhoff's work in color, which clearly shows that this monolithic material presents the most aesthetic form we've ever worked with. To me, it's all great, except the only really important thing is if I place a restoration in a patient's mouth, I don't want it to break.
Right, exactly.
And I don't want it to chip, and I'm just too much invested in it. And as I said today, if a restoration fails once, you've made no money. If it's made broken twice, you would have been better off giving the patient the money to start and not doing the dentistry at all. Because, you know, it's a challenge. It's not worth taking a risk. Object in dentistry is to diminish risk that would ultimately affect a dentist's pocketbook. And that's what dental economics is about.
Absolutely, absolutely.